whatever you're doing in your room is audible to the audience. Hello, all my super moms out here who've taken out their precious time and joined us for this webinar today. Today is a webinar on diastasis recti or core rehab, and we will be getting into what is diastasis, why core rehab is important in a little while. Today on this webinar, you have Arun Dubey, who's a nutritionist at MamaBe.Fit. She has 15 years of experience in this field. We also have Dr. Bhavna Girish, who's a gynecologist, and she's associated with Apollo and Motherhood Hospitals in Bangalore. And lastly, you have me. I'm Ankita Sahni. I'm the founder of MamaBe.Fit. I'm a certified pre- and postpartum coach and a certified diastasis recti coach. So before we begin, if you can hear us, please drop a thumbs up in the comment section so that we know there is no audio or technical issue from our side. Along with that, if you can also let us know from where you are joining us, which part of India or outside, it would be truly helpful for us to know what are the areas that are making a difference in the lives of. So now starting with a few basic things before we really dive into what we do at MamaBe.Fit. Why do you think postpartum fitness is crucial? While I'm going to answer this for you, if you have any answers to this, please leave them in the comments box. We would love to know your opinion on the same. So postpartum fitness, if you see the slide in front of you, the first thing that we've written over here is mental health. That is how important fitness is for your mind. Post-delivery, there's so much happening. It's completely new life. There's a new person in your life. There's sleeplessness. There's a loss of identity at times. And that is when taking that time out, even if it's 10 minutes for your fitness, can hugely impact how you feel mentally. Of course, along with that, we are taking care of new life, but taking care of ourselves should not take a step back. While it can be something that we don't heavily prioritize, it is still something that we need to do. And that is why postpartum fitness is crucial for that self-care that you need truly for yourself and your baby and the entire family. And coming from the scientific point of view, it is important to start rehabbing your body. When I talk about rehab, we are not just focusing on core rehab, we are focusing on your entire body's posture, internal alignment, mobility, and in general, taking care of all that stiffness, of all that change in the body that we feel because of the 9 months of pregnancy and delivery. So this is why these are the 3 main things that we feel are important where your postpartum fitness is concerned. Now, there are a lot of questions and myths that we often get on our Instagram, on our private WhatsApp, on postpartum fitness, and we would love to hear and answer some questions for you. So please drop them in the comments box below. Now, before I move on to the next slide, I want Dr. Bhavna to answer these questions for us. So, Dr. Bhavna, to you, please take some questions and myths that we often hear on postpartum fitness.
Yeah. Hi, Ankita. So I think one of the biggest questions people have when it comes to postpartum fitness is the most importantly, they ask us, when can we start? Now, this is a very individual approach that we should take. Every person's body has gone through childbirth and pregnancy and come out very differently. But as a broad guideline, what we gynecologists generally recommend is after a vaginal delivery, that is a normal delivery, you can start as early as 2 or 3 weeks. But we generally recommend you to wait until 6 weeks so your body and your uterus and all returns back to its normal size and position. If you've had a cesarean delivery or an abdominal delivery, it is recommended to wait a little bit longer, maybe around 3 months. But this is, again, like I said, a very broad guideline. There are a lot of women who might have to wait a little bit longer, particularly if you've had a complicated pregnancy and postpartum period. If you've had pregnancy complications like diabetes, hypertension, if you've given birth to twins or multiples, if this is your second birth, if you've had a traumatic or a difficult childbirth itself, be it an instrumental delivery or this is your second cesarean section, or you've lost a lot of blood, any sort of complications, then this approach needs to be individualized. Your body might take more time to recover. So your gynecologist is the best person to guide you. But this is what we broadly recommend. The second biggest question that they ask is, what can we start off with? So I think you are the best person to guide them depending on what is suitable for their individual bodies. But again, we generally recommend a combination of core exercises plus pelvic floor strengthening exercises. And these are things we recommend starting from your antenatal period itself, during your pregnancy itself, which you'll be continuing to the early postpartum. Starting off on more intensive, high intensity workouts, more intense training might take a little bit longer, at least 3 months, regardless of what is your mode of delivery. But you can start off with the lighter and the core strengthening exercises sooner rather than later. And ideally, in fact, should be started in your pregnancy period itself. Then there are a lot of other questions people have about what they should eat, what they should not eat, what they should wear. So I think as we move on, we'll be coming to each of these in detail. But broadly, these are the ones which most people have. And when it comes to a myth, a lot of women believe that you shouldn't exercise at all in this period because your body is weak and it might not be able to bear with the strength required for exercise. And there is no bigger myth than that. I think one of the biggest reasons a lot of women face bone problems and pelvic floor problems and all that in the later part of their life is because they have not taken care of it in those immediate few months and years after childbirth. That is a very critical time, and most of us tend to ignore it because we're too busy taking care of our kids and too busy recovering, so-called, in the traditional sense. And you have the whole confinement period where you're not allowed to go out, you're not allowed to get any fresh air, you're not allowed to eat a lot of healthy things. So your body takes a huge beating in that period. And we see the effects of this only in your perimenopausal and postmenopausal age. And by then it's kind of too late to go back to that period. So thankfully now awareness is increasing, and a lot of us gynacs are actually recommending our patients to take postpartum fitness into a huge consideration as something you need to be aware of and you need to do.
All right, so there you have it from the gynecologist herself, telling you the importance of fitness. You can work out when you're pregnant, you can work out for 3-4 weeks, or the timelines that she just mentioned. Of course, unless your gynecologist or your main healthcare provider has asked you not to for whatever reason with pregnancy and after. If your pregnancy is going smoothly, there is absolutely no reason to not work out. If anything, it's only going to benefit you. All right, so I think we've covered the common questions and myths. There are a lot more here. If you want to take some more from here, Bhavna.
Yeah, so I think I've already talked about what is the ideal timeline to start exercising. Yes, will exercise affect my milk supply if I'm breastfeeding is a huge concern. And in fact, it's the contrary. If you exercise, if you're giving attention to your physical fitness, your breast milk supply is only going to increase. So milk supply is a function of demand. The more your baby drinks from the breast, the more your body is going to produce. And remember that our body is capable of producing enough breast milk for 2 or even 3 babies. Even twins can be exclusively breastfed. So there is no reason to think that by exercising you're reducing your milk supply. Only thing you have to be aware is that breast milk itself is it's a good amount of exercise or calorie burnout from your body. So along with that, if you're doing exercise, you have to make sure that you're consuming enough calories to make up for that, and make sure you're avoiding dehydration and keeping your fluid intake as optimal as it needs to be. But it is extremely safe to breastfeed and exercise, not a problem at all. What's the right time? I think yes, we covered this already, but I would always recommend you take the green signal from your gynecologist before starting off. And your postpartum fitness needs to be something that you're doing under a trained coach who knows about this specific to postpartum. Because I have seen a lot of people either doing not untrained exercises all by themselves at home and accidentally injuring themselves or having more drastic consequences. Or if you go to a regular fitness trainer who is not aware of the special needs of postpartum women, again, you may be doing harm to your body. So make sure that you are following exercises from a trained professional and from the approval of your gynecologist alone. Do I need to wait until my 6-week checkup to start exercising? Not necessary. Like I said, if you've had a vaginal birth and everything has been fine, you've not had any complications, no tears, not had a lot of blood loss, you're okay to exercise. This is something your doctor will mention at the time of your discharge itself. Most hospitals these days have a fitness professional like a physiotherapist or somebody also doing a consultation at the time of your discharge from the hospital after your delivery, who will guide you better about what exercises can be done in the immediate period. And then, of course, at your 6 weeks checkup, you might also have your hemoglobin checked and other parameters checked to make sure that your body is on the right path to recovery. So, in case you've got any nutritional deficiencies or anything else that needs correction, along with your supplements, you can further go on with your exercise plan. The next question being, can postpartum fitness help with post-baby weight loss? Yes, definitely. But one thing I would also recommend is weight loss should not be your primary goal in the postpartum period. We should stop holding this unrealistic standard of wanting to return to our pre-baby bodies after our deliveries. I mean, your body has been through so much. It has created and birthed another human being. So there are obviously going to be some things which are not going to be the same. And weight is just that number which you may not achieve. I myself am a solid 4 or 5 kgs more than what I was before I had my daughter, and I am not concerned about it at all because I am much stronger now than what I was back then. Physically, I know that I am at my best. So that should be your target. If your target should be to get stronger, get fitter, and the challenges that come with raising a kid requires you to be much better physically than what you were before having a kid. So that should be your target. Though, yes, exercise will definitely help you shed off all those extra kilos. Any specific exercises I should avoid? Again, I think, Ankita, this is best taken by you, but broadly, your body has been through a lot, specifically your core, your central muscles have been stretched and weakened. So you want to avoid doing anything which is going to further weaken that. That means crunches, curls, sit-ups, all of these things in the immediate postpartum period, you definitely don't want to do. In case you've got diastasis recti, this is further going to worsen that. And also, your pelvic floor has also been weakened. So again, activities which further stretch your pelvic floor out, like lifting something very heavy and things like that, also weight training, all of these things again, you want to avoid those initial few weeks and months. Give some time for your body to heal itself, and then you can start out these things.
Yes, absolutely. So what we want to avoid is, returning and jumping into routines that we were used to before becoming pregnant. That is absolutely not the right approach. We want to take it easy. First and foremost, start with gentle mobility. You just want to release all that stress that your body is holding. Secondly, start connecting with yourself. You may have heard about connection breath a lot, and I will get to that shortly. But just connecting with your breath, including your diaphragm, abdomen, and pelvic floor. Getting the breath and these three things connected is what you really need to do. And more than that, anything that's causing flexion of the body, where it's making your upper body and lower body come together, where your stomach can start popping in the middle. So crunches, bicycle crunches, sit-ups, things like that are something that you need to avoid. So slow and easy, just lying down on the mat, on the bed, sitting on the chair. These things seem simple, and we have a wrong myth that only when you're really huffing and puffing and sweating, that's when it's effective. Sometimes, and more often than not, these gentle exercises where you're really going down to your deep core, deep pelvic floor can be hugely beneficial. All right, so what is our commitment to you in today's session? We, of course, want to answer all your questions. We want to guide you through your postpartum journey. And the reason that we have this panel today, and it's not just me talking about what we do at MamaBe.Fit, is because we want to cover you from all aspects that concern you. I may tell you fitness is okay postpartum, but you may not feel that's all right. That's why there is a gynecologist here who's also a mom who's going to tell you what needs to be done, how you do it, and whether this is okay or not. We have a nutritionist who's going to support you with the questions that you have on nutrition, tell you whether making changes in your nutrition post-delivery is okay or not. Is it going to affect that lactation or not? So our commitment is to give you a wholesome view on postpartum fitness and, of course, delve deeper into how we can help you. All right, so we have a range of offers at MamaBe.Fit, solely focused on moms post-delivery. We will also be coming up with something for moms who are pregnant, but that's a little later. So we have a range of offers. They are personalized for you, and you will receive a link for all of this post this webinar. We have certain discounts, we have certain offers, all of which will come to you at the end of today's webinar. All right, now, what do you get in this webinar? I actually like to call it a workshop because we're talking about so much more. You get a nutrition guide tailored for new mothers. We have parenting principles, which is very, very important for all the parents out there. Solids, when it comes to 5 months, we start hyperventilating on what solid, how to do it, what should I shop, all of that. There'll be a shopping list that we will send to you. Plus, postpartum workbook. This is something that I didn't know, but after delivery, I had a diary and I used to write when my baby, had last feed, when she did the last susu, when she did the last potty. We have a log of all of that, and of course, my pump log. I have a pumping log in the first month. We want to give that to you. And of course, with this, we want to do your nutrition calculator. Very, very important to make sure that you are eating according to that nutrition calculation that your body, your specific body needs. So that depends on your height, weight, resting metabolic rate, and of course, the number of times that you're eating your baby, whether you have to wait articles and all of that. So we cover all of this at the end of this webinar. All of this will be. So who am I? I introduced myself at the beginning. I am Ankita Sahni. I was in the media for 10 years before I started MamaBe.Fit. This idea came to me, post-delivery at 7 weeks. I was feeling quite okay. I had a C-section delivery. And I thought, okay, let's just go for a run. That was the right idea then. But why I did that was because there wasn't enough information out there on what you should do. There was, okay, don't do this, don't do that, don't do matches. But what to do? What is the progressive way to get back to this missing? And that's when I realized that in India, our moms must be facing that all the more. So fellow moms must be facing that because there's so many myths. Don't work out like this, work out at this time. So I was like, to break through all of this, to help mothers understand fitness and take charge of their health and do the right thing, why not get certified and start training? So I didn't just launch with my knowledge. I launched my Insta page after I had completed my certification in personal training, pre and postpartum, and recently, of course, I did my Diastasis Recti course as well. Now, what I learned in my fitness journey postpartum is something that I never learned before. I had my baby when I was 34. I was into fitness from 18, and I was always yo-yoing. So there would be 3 months when I'm really eating well, working out, whatever, lost the weight that I want to, and then once I lost and hit the weight that I want to, and I'm okay, yeah, I hit it, now let's just start eating normally. So slowly, you take it easy, you start getting all the foods that you want, and you gain it. But you know what happened to me after delivery, and this is really true? I just focused on eating well because there was no way that I could eat less post my baby. I was feeding her exclusively for 6 months. So I was just eating healthy, mainly home foods. And what that did was it helped me lose 24 kgs. I lost that in about 8 to 9 months. I had reached 70 and a half. While I was pregnant, I came down to about 46 kgs without trying, without worrying about weight loss. Did I want to lose weight? Of course. Nobody wants to always remain 70, 80, whatever kgs that is. But that wasn't my focus. I was enjoying my postpartum fitness because I was really enjoying the me time, like I mentioned in the beginning. I was enjoying healthy foods because for me, healthy food was not only about myself, it was about what is going to my baby through my breast. And the side effect or the end result of this was weight loss. So what I want to tell you here is, if you just eat right and move right, weight loss is going to be the effect of it. So don't make that your goal. Make eating right and working out right to become strong, like you have now mentioned your goal. Weight loss will happen. So all of this, my own personal journey, my own journey with training moms for the last 3 years has given me a unique understanding of different bodies, different mindsets, and that is why I'm here to help you today. So that's me. That's with my baby, I think, a week before I delivered. That is me 9 months postpartum. I am not showing you this picture to show you the drastic weight loss. I am putting this picture here to show you that if we just eat right and move right, body will do wonders for yourself. All right. And one thing that helps a lot is being consistent. So no matter what happened for me, whether I could give 20 minutes to my workout, 10 minutes or 1 hour, I made sure that at least 5 days a week I gave that time. I had my baby sometimes sitting on the mat playing with me. I used to put her to bed sometimes, go out for a quick run or a quick walk, come back. Whatever it is that you could do. Sometimes I would just play dance video on YouTube to do that. So you don't have to have very tough goals. Identify what you enjoy. You want to go for a walk, you love that, do that. You want to go swimming, do that. You want to just dance, do that. So choose what you like, that is how you will be consistent. All right, and of course, along with this, 80% of all weight loss, 8% of all the strength that we have in our body is through nutrition. So a nutrition diet that you need postpartum is very essential. It is not the same as pre-pregnancy. And we will come to the details of nutrition shortly. So have nutritious, healthy home meals. Don't try and go for anything fancy, anything different, fall for the fats. Whatever you've been eating, जो आप बचपन से खाते हुए खाए हो, वही खाओ. Just make it more. All right. And like I said, this entire journey of MamaBe.Fit has been just my personal journey which I've tried to help other moms with. So I understand you, I empathize with you. There are so many moms who call me to join my plan, and we actually end up talking for 1 hour about maybe a little bit of mental stress that they're facing, or how they're feeling overwhelmed after delivery, or how they're feeling that they've lost identity after delivery. So I'm here for you on those terms as well. We have a gynecologist for you in our team. Every time you have any issues, you can join. You can get a guide from her. We have a personal nutritionist who can help you with your challenges of cooking. And of course, I am here to just help you to do fitness and whatever else you need. So coming back to our body changes, what happens in pregnancy and post-delivery? I will hand this over to Dr. Bhavna to help us.
Okay, so coming to the changes which happen now in pregnancy, these changes start as early as the first trimester. So your first 3 months of pregnancy is when your body is undergoing the most number of changes, though physically you may look exactly the same as you did before pregnancy. The biggest change that happens is because of progesterone, which is your pregnancy supporting hormone. What progesterone does is it is a muscle relaxant. So it causes relaxation of all the muscles, including the smooth muscles on the inside of your body, as well as your striped muscles and the skeletal muscles. So there is going to be a lot of relaxation. A lot of yeah, sorry, I got disconnected there for a second. So what happens is there is a separation of your central midline muscles, that is your rectus abdominis muscles. These muscles are long vertical striped muscles which start from your zippy sternum, from your breastbone, and go all the way down to your pubic symphysis, that is your pubic bone. So what happens when these muscles spread apart is your uterus gets more room to grow and grow forwards. And this is necessary for the birth of the baby. And this is an evolutionary change which has happened in human beings because we are upright mammals. This is not something which happens in other mammalian species because they are four-legged. But unfortunately, because of this, we have a lot of pregnancy complications as well. So something we just have to bear with. Along with that, there's a relaxation side muscles of your body, which is going to be your transversus abdominis and external and internal oblique muscles. These are also stretched out along the sides of your body when your uterus is growing. Then towards your third trimester, you also have a pelvic floor relaxation. So a lot of women in this time do start to get a little incontinent, both to urine and stools, because your pelvic floor starts relaxing and the sphincters of your urinary bladder and your rectum are also relaxed. Again, these are normal changes, which is why we recommend pelvic floor muscle training exercises again as early as your second trimester of pregnancy. Towards the end of your third trimester, you start to get something called as an exaggerated lumbar lordosis, where the lumbar spine, the spine of the lower part of your vertebral column, starts to get forward like this. So you have that characteristic waddling gait that you start to get in your third trimester, and the sciatica and the lower back pain that you also start to get in the third trimester. This is because of an exaggerated lumbar lordosis. So all of these things keep exaggerating as your pregnancy progresses. Post delivery, it takes a minimum of 6 weeks for all these muscles, bones, and ligaments to return to their normal. But it is quite normal to not have them be 100% what they were. There is going to be some degree of residual laxity, residual weakness happening, and this is only going to increase with the delivery of every successive child. So these are changes which are going to stay. By muscle strengthening, you can only reduce the amount of laxity that has happened, but we can always tell that this body has been through a childbirth because that some degree of laxity is going to remain.
All right. So at this point, I'd like to just take some questions which are related to this slide. There's someone asking, my tummy is coming out. Does diastasis recti affect appearance of the belly also? Excellent question. Yes, diastasis recti does impact the appearance of your belly. In fact, 3-4 months postpartum, if you're still looking like you're pregnant, it is a good idea to get your diastasis recti checked by a pelvic physio or your gynecologist. So it can look like the picture in front of you because of the separation. If that's happening, yes, diastasis recti could be there, and we need to check for both the width and the depth of it. All right, and I'm breastfeeding. Will it affect the rate of diastasis recti healing? No, that has no correlation. The only correlation between your nutrition and diastasis is the foods that you eat. We need to make sure that we're eating foods high in protein, not heavy in protein, high in protein, because that helps with muscle repair. At the same time, you want to be eating food that constantly keeping you bloated, because that air is going to push against the wall and the separation will remain as is. Let me see what else we can take. Does this condition cause discomfort or pain? Very good question again. Yes, diastasis recti or weakness, pelvic floor weakness can cause pain. It will radiate as a back pain more often than not. It can also give you a general feeling of being tired, general feeling of loss of strength in your lower body. So there are more questions. We'll come to that as we go forward in this webinar. Now, post-pregnancy challenges. Again, I would want Dr. Bhavna to take this.
Okay, so yes, this is the number one question most people have is, can I return to my pre-pregnancy weight? Again, I think I've covered this in detail. I never recommend this to my patients, because this kind of sets this unrealistic goal and standard, and then you tend to put a lot of pressure on yourself, which means you may diet, you may do exercises which are not good for your body, and you may drastically lose a lot of weight. Now, you shouldn't keep that goal. We see these actresses and people in media returning to their pre-pregnancy body weight within 3 months of giving birth. But what you should also realize is your circumstance may be different. They may not be breastfeeding their child, or they may have more than enough help to take care, and you may be taking care of your kid independently. You may be exclusively breastfeeding. You may have many other family members to attend to. So this, like I said, should not be your primary goal. Your goal should be to return your body to the best state of fitness that it can be in, to be at your healthiest, and to make sure that you are being able to take care of your baby the best that you can. Now, this is not a competition. You are not to compare yourself with anybody, any other person, or with your own self. You don't need to fit into the clothes you fit into before you gave birth. This just should be a target of being the best that you can be. That's about it.
All right, coming back to the importance of core rehab. This is something that Dr. Bhavna touched upon, something that I touched upon right at the start of the webinar. Now, your core, of course, and your core is not just your stomach. Your core starts right from your diaphragm, goes all through the abdomen, goes to the pelvic floor, which is your urethra, vagina, anal cavity, goes up to your multifidus muscles at the back, and goes up all the way to the end of the diaphragm. So right from here, around and down is your core. All right. So now What is the importance of core rehab? It will help you firstly connect back to your core. Your breath and core need to be connected. That is why core rehab is important. In turn, slight gentle movement using that connection breath will help you prevent back pain and injury. This will also improve your posture and stability. It will enhance how you feel through the day. For example, if you're feeling really tired, once that core strength starts coming back, you will feel a little more energetic for the simple reason that your core is everything besides your limbs. Essentially, your body's foundation is the core. Now, if that is weak, you're going to be feeling imbalanced, with a bad posture, tired, all of that. Once we rehab everything, it is all going to come in that single kinetic chain. The muscles are going to be strong again, and you're going to feel energetic. And of course, lastly, I always want to call weight loss and how we look as the side effect of this, the appearance of your stomach, which is the biggest concern. I get at least 20 messages daily on how to lose that belly fat. Will start getting better when you start investing these 4 exercises along with. Now we're going to give them some more post-delivery tips. We've taken a few. We'll see what else we have in our questions. So, Dr. Bhavna, I'm just going to come back with some questions to you again. All right. So, I have gained around 10 kgs of extra birth after baby, and my family is asking me not to work out. What should I do?
Sorry, Ankita, if you could just get back, repeat the question because I had a little bit of a network issue.
So the question is from someone who says they've gained 10 kgs, their family is not allowing them to work out. So when is the right time? I know you've covered it, but in a situation like this, what should the person do?
So, because of how much weight you've gained in your pregnancy, the numbers remain the same. When you return to your workout would be more a function of if you had any complications during your pregnancy, that is medical complications like hypertension or hypothyroidism or diabetes or anything, and also your mode of delivery, whether you had a vaginal birth, whether you had a cesarean section, and whether you had any intrapartum complications, that is complications like excessive blood loss or your surgery was prolonged, you had a lot of adhesions or your uterus was stuck up. These are all complications which your gynecologist will be able to guide you better. But the overall guideline remains, about 2 to 3 weeks after a vaginal delivery for light core strengthening exercises, 6 weeks for your regular workouts, and 3 months for a cesarean section.
All right. The next question we have is from someone who's asking whether maternity belts or tying those saris will cause a flat belly. How, as a gynecologist, do you view this question?
Again, sorry, let me just reconnect. There is some sort of network problem which is making me get a very...
Sure. So we'll wait for Dr. Bhavna. In the meanwhile, I'm going to take other questions. I'm breastfeeding and I have been told not to work out as that will affect my supply. This is a question that was answered before. Working out, if anything, will help your supply because you're going to be hydrated that much more. You're going to be eating healthy foods that much more. Of course, if you're purposely cutting down calories to get into the weight loss zone, into the fat burning zone, you may have a problem. So it's absolutely okay to exercise while breastfeeding. Dr. Bhavna, the question was, as a gynecologist, do you recommend using maternity belts or tying saris to flatten that belly?
No, not at all. It's a personal choice, but what I say is that's more of a traditional practice. It's not going to help flatten your tummy. What's going to help flatten your tummy is doing your core exercises. So the rectus muscles, which are separated, will come back closer together. And the minute that gap reduces, the flabbiness of the belly is going to reduce. A belt is only going to keep it tucked in and snug. So you may not be able to see that bulge, but it's still very much there once you take it off. And in fact, I have seen patients do the exact opposite, wherein they tie the belt way too tight. So you're effectively cutting off the blood circulation to the anterior abdominal wall muscles, which is going to be more harmful and further weaken them in the long run. So a belt is something which surgeons recommend if you've had a hernia surgery or if you have an umbilical or a ventral hernia, but not required after childbirth because there is no surgical cut happening to the muscles. It's just that the muscles have separated.
All right, and this is so interesting because Dr. Bhanu, when I had my baby, I remember, I wasn't a coach then, I didn't know a lot then, and there was this sari that was tied around me, I think some 7 meters of cloth, and I kid you not, I could not breathe for 2 minutes. I took it all off. I felt like there's no oxygen, and more than that, now I learn as a postpartum coach that it actually upsets the intra-abdominal pressure, the pressure which is held within your diaphragm, abdomen, pelvic floor. And that is exactly why diastasis can be, sometimes delayed in healing if you're not balancing the pressure. So if you're only wearing the belt or the sari for that, it's actually just going to make it worse sometimes. So avoid that completely.
Right. And one more thing I want to add, Ankita, is these saris particularly, they're not washed, or sometimes they're not sterilized. And if you've had a cesarean birth and you've got a scar there, I've had patients who've tied the sari so tight, so you're not only cutting off circulation. There, in our Indian climates, there's a lot of sweating which happens, especially if your stomach is bulging forward and falling onto your scar. So all this sweat accumulates on the scar, and that is going to further infect your scar. So we've had people coming back with wound infections because they've not taken care of this. So my suggestion would be just let it breathe, air out your abdominal area, make sure you're wearing comfortable cotton clothing as much as you can, and keep the area as dry as possible.
All right, thank you for that. So coming to some more frequently asked questions, we've answered some, we'll take the ones we haven't. I'm coming to number 3. Can I exercise if I have diastasis recti? So the answer is simple. Yes, you can, but there's a certain exercise module that you need to follow. Only exercises which focus on your core, pelvic floor, help you learn connecting, help you learn engaging and managing your core are things that you should do. Once you have learned all of this, then with diastasis recti, even traditionally, band exercises per se, for example, a plank and things like that can come in, but that's after you've learned your pressure management, your breathing, your core engagement. So the answer is simple. Please exercise for your diastasis recti to heal. These will be specific core and pelvic floor exercises. First, which once you've learned how to manage your pressure, you can go on to regular workouts as well. Number 5, is it safe to engage in high intensity workouts post-pregnancy? Dr. Bhavna answered this. 3 months postpartum, definitely not. Even then, if you've not done your core rehab, start gentle, work on your core rehab, work on your mobility posture. Slowly start with low intensity interval training, going into high intensity interval training. I've answered number 6, can I exercise if I'm breastfeeding? Number 7, how do I balance exercise with taking care of my newborn? Now, first of all, you have to understand, don't make this exercise this magnum opus project that you have to do. I've done an extensive read on this on my Instagram and I'll share that with you. But what you need to do is make sure that you're only giving small goals. So I'm going to do only 15 minutes. Make a schedule 15 minutes of workout. This is the time that my baby sleeps. No matter what, I'm not going to be lazy. I'm going to show up for myself, work out then, and choose a format of workout that you enjoy. There will be days when it's an overwhelming day, you've not slept, your baby is cranky, you are tired, and it's okay not to do it. As long as you're getting some movement in, it's okay. If no movement, just be active through the day. After meals, if you can walk for 10 minutes to balance your glucose. After dinner, if you can just go out for a stroll just to feel good. That is enough also. So small goals make the biggest difference. Number 8, what is the role of nutrition in postpartum fitness? A huge role, and we are coming to that shortly. How can I prevent postpartum pelvic floor issues? Good question. So a lot of it can be prevented by exercising in your antenatal period. But sometimes, like Dr. Bhavna mentioned, there can be certain issues while you are in labor. It could be a traumatic birth experience, it could be a hard labor, there could be a lot of stress in your uterus itself or pelvic floor that's causing the issue. So in that case, how you prevent it may not be the right thing because it will happen irrespective, but investing immediately into good pelvic floor core rehab will start taking care of that. So in pregnancy workouts, which focus on your core, focus on your rehab for your core, and post-delivery, this should help you. So you cannot prevent it, but you can definitely minimize it. And before I move on to the next question, I would like Dr. Bhavna to shed some light on the same. How can I prevent postpartum pelvic floor issues?
So your go-to answer for this is going to be Kegel's exercises, which is your pelvic floor training exercises, started as early as your first or second trimester of pregnancy. So Apart from the effect of progesterone, the pressure on the pelvic floor starts even earlier in pregnancy than you can feel. There's a reason why we have frequent urination in your first and second trimesters of pregnancy. So, second trimester of pregnancy is the ideal time to start a workout because a lot of women feel a lot of weakness and lethargy and mood swings and things like that in the first 3 months. The second trimester is a time when you feel that energy, you've got the ability to exercise, your tummy is still not too big, and you want to learn something new, like you've never done Kegels before. This is probably the right time to start doing it. Towards the third trimester, again, your energy levels are very low, you are not able to move around too much. So, if you've started it in your second trimester, you can continue doing it in your third trimester. Otherwise, you may not have the motivation or the energy to start it in your third trimester. Then, after your delivery, your Kegels exercises or your pelvic floor exercises is the first exercise, in fact, you should be doing, especially if you've had a vaginal birth, because your levator ani, which is the main muscle of the pelvic floor, takes the biggest burden of the injury in a vaginal birth, especially again if you've had an episiotomy or a vaginal birth, a tear which is given, a cut which is given during the birth. So this you can start as early as a week to 10 days even after your delivery. And number of Kegels, there is absolutely no limit to it. You can be doing it every hour, once in 3 hours, 3 or 4 times a day, whatever you're comfortable with. And this is something which you don't need to devote time to at all. You can do it while breastfeeding your baby, you can do it while sitting and watching TV, or you can do it anytime. So Kegels exercises are the most important things you should be doing to prevent your postpartum pelvic floor issues. And the second thing would be avoid putting additional pressure on the pelvic floor. So don't strain while passing stools. If you've got constipation, that is a problem which needs to be addressed. If you've got urinary incontinence, that is a problem which needs to be addressed. These two are things which you need to talk to your gynecologist about. Third is your muscle growth. Of course, nutrition wise requires all your proteins and all that. But calcium supplementation is another thing which is an absolute must and should for all women, again, in pregnancy as well as postpartum, as long as you are exclusively breastfeeding. So, calcium is necessary for your muscle channels to be activated and for strengthening your muscles and bones.
Thank you, Dr. Bhavna. Coming to question 10, what signs indicate I should stop or modify my workout? Great question. So there are several signs that you should look out for. One is, and the main thing, especially after delivery, is whether your stomach is coning. What that means is there is the rectus abdominis, which is your six-pack muscle. If the pressure is not held in a balanced way within that, the stomach will start coming outside, and that is what we typically call coning. So if your stomach is coning in a particular exercise, and this is something that you will see in the workbooks that we hand out to you, you want to avoid that. So certain exercises, for example, if you're doing a toe tap, you may feel a coning, but if you do a heel slide, you may not feel. So you want to just regress this. More than that, if after the workout you're feeling soreness, that's most of the time normal, but it goes on and on, not able to get through the day without, just sleeping or feeling lethargic, you want to cut back on that as well. Number 11, how do I measure progress in postpartum fitness? Typically by how you feel and how your core feels. For example, if you're invested in a core rehab program, how you feel after a month of workouts, 2 months of workouts, that is your best bet. So progressive measure month to month is the best measure of postpartum fitness. And the last, do I need a fitness professional to guide me in postpartum exercises? Yes. A postpartum body is a completely different body, and only someone who has an understanding of that body should be guiding you at this stage. So I highly recommend investing in postpartum fitness with a fitness professional. All right, tips for postpartum recovery for new moms. We've covered that in detail, but we quickly just go over it. Dr. Bhavna, if you could just take this slide for us, please.
Yeah, so prioritize your rest and sleep. If you're already sleep deprived, a newborn is got maybe waking cycles of 45 minutes and sleep cycles of about 1 to 1.5 hours. So you are going to have to adjust your body to that. And that means you're feeling extremely sleep deprived, you're extremely tired. So prioritize.
Yeah, so we prioritize our rest and sleep, maintain a well-balanced diet. Make sure that you're having a diet which is balanced. We will come to that
As
as our
much as you
nutritionist body.
for the rest of the household. Do not get worked up about not eating those specific foods that everyone, your traditional practices say you need to include garlic, you need to include one particular leaf, you need to include these. So if you feel like eating them, well and good. If not, try to include whatever you can that you feel like eating within the boundaries of something that is healthy. Stay hydrated, very, very important. Again, a traditional Indian practice is for some reason to deprive women of water in the postpartum period. But we need to know that breast milk is almost 80 to 90% water. If you don't hydrate yourself, if you're dehydrated, your breast milk is going to reduce, your muscles are going to get fatigued, and you are overall just not going to be able to recover. Pelvic floor exercises, I think we've already covered in good enough detail. Gentle exercises and diastasis recti exercises, like Ankita has advised. Supportive garments. Now, make sure that you're wearing a supportive bra. That may be what is comfortable for you, either a nursing bra or a sports bra, but a bra is necessary. Your chest wall cannot fall forward, and if your breasts are not well supported, there is a high probability of breast milk accumulation and infections happening. So a tight, well supporting bra is an absolute must. Again, it needs to be cotton, it needs to be able to absorb sweat, and it needs to be the right size. So make sure that you are prepared with these right from before you give birth. These are going to be necessary for the next 6 months to 1 year. So investing in these is always a good idea. Emotional well-being. Now, this cannot be underlined enough. So again, take all the help that you need. This is not something that we women are meant to do alone. So no matter what it takes, prioritize this, prioritize yourself. Hygiene and wound care, depending on what is your mode of delivery, will be advised by your gynecologists. So that needs to be taken care of. Focus on health and well-being over rapid weight loss. I think I have already covered this. Spend quality time bonding with your baby. Now, in the initial few months, motherhood is not one of those things that comes naturally to everyone. You may not initially be in love with the being that you have birthed. You may not feel that connect. Postpartum depression or postpartum blues are seen in up to around 50 to 60% of women. So spend time on your mental health, spend time bonding with your baby. It may be in any way that you like. You may want to read books, you may want to spend time just resting, whatever it may be, but find an activity that you truly enjoy doing and do it with your baby. Attend postpartum checkups to monitor your recovery. The usual schedule that we recommend is 1 week after your delivery. Then after that, a month. If there is any concern in between, we may call you in for earlier checkups. And after that 6-week checkup, you really don't require anything further unless you've had any complications. Consult a lactation consultant if you encounter breastfeeding challenges. Again, extremely important. Because we have, first-time mothers, it is a challenge. It's not something that comes naturally to a lot of people. And you may be facing issues with low supply, excess supply, latching, whatever it may be. These are also not things which you can read by yourself and solve or depend on traditional wisdom. Now, we have trained professionals to help you out in these things. Go and approach them. They'll be able to help you. Most of the time, breastfeeding is possible, even if you think that you just cannot do it. There may be some little thing that you're missing, which may set everything back on track. So put in that effort and again, make that investment. Don't rely on some random relative or neighbor to help you out in this, because every person's concern may be different. And in case you have a lot of issues, you need to get your baby evaluated for a tongue tie, you may have a flat nipple. All of these things are not things that your gynecologist or your pediatrician will be able to diagnose also. So lactation consultants, again, we have a lot of them now. They're available in all the hospitals as well. So that it is best to go and have a consultation with them. Talk to your husband, may not understand what you're going through. Your mother or your mother-in-law are waiting at the time again. Things have changed a lot. So you need that
All right, so I think there's a little bit of audio loss here. So what she's talking about is prioritizing self-care, which is something that we mentioned in the beginning. Make sure you have a supportive partner, supportive family. Talk about what you're feeling. Talking is the best thing that you can do at this time rather than internalizing. And of course, join postpartum support groups, talk to fellow moms, and you will definitely go through the entire recovery period in a much better manner. All right, self-care insights is something we've covered. Strategies to address sleep challenges and fatigue in newborns. So I think we covered that in the last slide. You want to balance your schedule, and always sleeping along with the baby is not possible. At least that's not something I ever could do. But if that's something that you can, please sleep along with your baby. Try and keep your goals simple for the day, that this is all that I'm going to be doing. Don't juggle with too many things, and it should be something that you can help to balance how you're feeling mentally and physically post-baby. All right, so diastasis recti, we've already explained you what happens. The rectus abdominis muscle, which is there, it separates to accommodate the baby. Post-pregnancy, post-delivery, 3 months post-delivery, it should come back to its original position, like you see the normal abdomen in the picture. If it doesn't, you will still look as if you're pregnant. There will be this visible gap. That's when we call it a diastasis. Dr. Bhara, you want to shed some more light? All right.
Yeah, Ankita, am I audible?
Yes, please go ahead. All right, so till she comes back, just talk about diastasis recti. Rectus abdominis, which is connected by the linea alba. Linea alba separates to accommodate the baby. Rectus abdominis then separates, it's not together. If it doesn't come back, we call it a diastasis recti. Now, what is its impact on belly fat? Because you are experiencing a belly which still looks pregnant, that is the biggest impact of diastasis recti on a physiological level, on how it is looking and feeling. But internally, it can have a lot more issues. You may feel bloated, you may have constipation, you may have pelvic floor pain, you may have pelvic floor weakness, back pain, difficulty in getting up, turning from side to side. So besides the belly, there's also a lot of other impact that can be there because of a diastasis recti. Dr. Bharna, do you want to shed some more light on the impact of diastasis recti and the belly?
Yeah, so because of the weakening of the linea alba and separation of the rectus abdominis muscles, you have a protrusion of the abdominal viscera, that is your fat, your subcutaneous tissue, and that protrudes forward, which gives you that bulgy looking belly. And until that gap is closed and the muscles are brought back together, this bulge is going to remain. Now, this is not like a hernia or something which needs to be surgically corrected. There, in fact, is no surgical correction for this because it's more of a weakness than a tear. But exercise is definitely something which helps reduce this because there have been enough studies also which have shown, even though there have not been large-scale population studies, I was just reading this one which came out in 2019 where on 40 women, they did about 8 to 12 weeks of core rehab exercises, and there was a reduction in the width of the gap of the diastasis recti, and also they felt comfortable. They felt that the tightness was nicely increasing, that laxity which is there, the sensation of it being loose and pain down there also reduced. So a minimum of 12 weeks is what is generally recommended to see any sort of result. And long term, of course, significant improvement. The longer you exercise, the better it is.
All right. Okay, how can you effectively reverse the Mommy Pooch? So Mommy Pooch can sometimes be slightly different from how diastasis recti is impacting your belly. But of course, we've covered this already. A lot of core and pelvic floor exercises, workouts that balance the diastasis. So there's a diastasis above the navel, on the navel, and below. So you want to work on all of these three. You don't want to work on only the belly, which is something that we always focus on. So all of these three investing in exercises work you in different places. So lying down exercises, sideways exercises, when you're on your toes, seated exercises, standing exercises, all of this helps you. Most importantly, a progressive approach. You cannot be doing the same exercises from the first week, say, till 12 weeks. So a progressive approach of exercises is another thing that helps you. Nutrition matters a lot where your belly fat is concerned, and that's where you need to make sure that you're eating a balanced plate, you're well hydrated, and along with this, of course, adequate sleep is very important. In the core strengthening exercises itself, at least in my classes, we start with first making you understand the postural imbalances, the alignment imbalances. We help you correct that, understand breathing, and thereafter go to core strengthening. So all of these together will effectively help you in reducing that diastasis gap and reducing your belly fat, and slowly strengthening that core towards how you felt before pregnancy or even better. Now, breastfeeding posture, very, very important point. Handing it over to Dr. Bhavna to cover.
Yeah. So one thing we really need to keep in mind while breastfeeding is to keep your back as straight as possible. So one of the most common reasons why in postpartum period you face a lot of back issues and back pain is because we tend to bend forward to meet our baby. But what every lactation consultant is going to teach you, and what you need to know, is that you need to lean back and you need to bring your baby to you. By leaning forward to your baby, both the latching is going to be wrong, plus your muscles are going to get a lot of strain. So for breastfeeding, you need to be able to find a comfortable place where you're able to do this. This can either be sitting upright in your bed or getting a feeding chair. A breastfeeding pillow is something I recommend all my patients to purchase. This can either be one of those U-shaped pillows or one of those boppy type pillows which are layered one on top of another, whatever works for you. But this is going to help elevate your baby to the level of your breast, so you're not leaning forward to meet it. And there are many, many postures for breastfeeding: a cradle hold, a football hold, the sideline nursing. Again, completely individual, up to you what works for you. But make sure that you're not bending forward while doing this, and make sure that your baby is able to latch on properly. So while latching, you should make sure that the entire areola is going in the baby's mouth. This is going to give a deep latch and it's going to make sure that your breasts are getting emptied completely. You need to find a good, spacious place in your house which you're dedicating for those early months of nursing. So this has to be something which has got everything equipped. You've got a good chair, you've got a water bottle next to you to drink water from while nursing, and some snacks or something what you may want to have again while nursing. It is completely normal in those initial few weeks to have marathon nursing sessions lasting for half an hour, 45 minutes. So be well prepared again from your pregnancy days itself to dedicate the amount of time that it takes. This or your family members also have to be aligned on this particularly. And with regard to with alternate sides and all of that, again, ideally breastfeed from one side. Once that breast is completely emptied, then switch over to the other side. For some babies, both sides may be needed at every feed. For some babies, one might be good enough. So that again, baby depends, and I would recommend a detailed. It's a topic in itself. You can talk for hours on breastfeeding. So I would recommend detailed assessment by your lactation consultant who can guide you specifically on all of these things, and make sure you're again taking your calcium and iron supplements while breastfeeding.
All right, coming to the most important question which everybody has: how should you plan your diet while breastfeeding? So over to you, doctor. So over to you, Parul. I've just been in a habit of calling everybody doctor here.
Thank you, Ankita. So coming to a very, very important aspect, after you have delivered and you're breastfeeding, of course, is the nutrition. And let me just go through some of the key aspects that you have to keep in mind, while you're in this very crucial and critical phase. Now, of course, the first is stay hydrated as much as possible. So, have your 8 to 10 glasses of water. That's at least minimum that you should be drinking. And of course, Dr. Bhavna has already, mentioned before that if you are dehydrated, then your breast milk supply is definitely going to reduce. So we would like to underline and underscore this point again. Please, please stay hydrated and keep your water top up at all times. Now, the second point, of course, is a balanced diet. What is a balanced diet? So when I look at a plate, I should be able to see all food groups on that plate. So, for example, you should have your complex carbs, all right, in the form of your whole grains, whole cereals. There should be enough protein, so I should see a good amount of protein there, either in the form of your whole pulses, lentils, or even if you take egg or fish or lean meats, along with, of course, some fiber. So we need your salads. Take, for example, you have cucumber, cherry toms, or carrot, anything that you can eat raw. Please do try and incorporate that on your plate, along with, of course, some good quality fats. When we say good quality fats, we're looking at your avocado, we're looking at nuts and seeds. All these food groups should be present on the plate to make it a balanced diet. Now, coming to fruits and vegetables, all of you know that fruits and vegetables give us the vitamins, the minerals, the fiber, and you should try and aim for at least 2 fruits in the day. Any seasonal fruit is wonderful because it is in season and it is the most rich in its nutrients at that point. So 2 fruits and 3 vegetables in the day. You can opt for 1 green leafy vegetable. Always do try for a green leafy vegetable, along with 1 root. It could be a sweet potato, it could be carrot, could be your, whichever root you would like. Along with, of course, with 1 gourd, like it could be a bottle gourd, it could be snake gourd, something which has a lot of water in it. So try and make your 5+ a day within the day, and keep it seasonal at all times. And iron-rich foods, again, how Dr. Bhavna has emphasized that you need to have your iron-rich foods. So something like your greens, your drumstick leaves, your moringa leaves, of course, any kind of addition to your atta dough, like coriander, simple thing like chopping up your dhania leaves, all right, and adding it to your atta dough, okay, or even your dill leaves in your dosa batter. So these things, add a little bit green and, of course, the iron, non-heme iron, which is fine, which, when you pair it with the vitamin C, will become heme iron. So do try and opt for these, along with your calcium-rich foods. As, we say, go for your broccoli, go for spinach, go for your white beans, your black beans, your lentils, your amaranth, your quinoa, of course, tofu. All of these are rich in calcium. And you can also ensure that there's some lactation-friendly foods, all right, that you can have, like your fennel, your garlic, your ginger, okay? All these support your lactation, that is the production of milk. So do keep these in mind. And do I have any questions? Just give me a minute. And always consult your dietitian for more guidance. This, of course, is a broad umbrella guideline for you.
So, Parul, we can take some questions here. There is a question coming in: what foods to avoid postpartum? Is there something specific that people need to avoid?
No, not really any specific food, but of course you will get lots of advice from your in-laws. You will get advice from the elders in your household, so you may be a little bit more wary about that. But nothing in too much of excess or nothing too less. Just keep it in a good amount. There's a moderate consumption, so that you're having a little bit of everything. There's no such absolute no or absolute yes.
All right. And one question which we get very often, people have this concern immediately after delivery and as they breastfeed: how do we increase our milk supply? So tips for that, please.
Yeah. So again, how do we increase our milk supply? I just named some lactation-friendly foods like your fennel, your ginger, your garlic, all these will definitely help, improve your milk supply. So we do, if you look at the diet chart that you will receive, we give a very nice, simple detox in the morning where we add half an inch of ginger. Where in the boiled water, we add half an inch of ginger, some fennel seeds, along with a little bit of haldi for immunity. And if you drink that, it will really, really help with the day's supply.
All right. And one more question before we move to the next slide. How many calories should be consumed while breastfeeding?
So that's a good question. I mean, generally, we always give a buffer of about an extra 300 to 500 calories in the day if you're breastfeeding, because that amount of energy is required in order to produce milk. So we have a baseline on your ideal body weight. We calculate your calories, and then we add another 300 to 500 calories to ensure that you are got good energy and you have that amount of calories to produce milk.
All right. Another common question we get, Parul, is my baby is colicky, so should I avoid whole pulses, cauliflower, cabbage, onions?
What was the question again?
My baby is colicky, so should I avoid whole pulses, cauliflower, cabbage, and onions?
So yeah, so there is actually, that's a very, very popular question. I do receive it. So there is actually no one-size-fits-all answer to this question. So colicky babies, they are a little bit challenging, and foods that will trigger are, of course, your cruciferous vegetables like the cauliflower, cabbage, broccoli. So these are to be avoided. Legumes and whole pulses like your chole, rajma, your lobia. Onions also have a lot of gas producing substance in them. So you can avoid any like whole onions, for example, in a salad. If you cook it, it can bring it down. And if you suspect any kind of discomfort that you are experiencing from a certain food, then please eliminate it. And you know best which food you are feeling comfortable with, after having consumed it, and which is not. So even if you have a little food diary that you can say, I just had this particular, combination of foods, and after 2 hours I was feeling like this, then you can plan your next day better, saying that, no, this is not suiting me right now, so I better not go for it. And also you need to be a little bit patient, because it does take several days for any potential trigger, trigger foods to be fully out of your body and into your baby system. So just be a little bit patient. Definitely, if you have eliminated the food after a day, it might take 2 days or 3 days for your baby to stop feeling that. All right, so don't get too worried about it.
All right. Another question which I often get, Parul, on my DM is, once people join our program, their concern is, will the diet chart support my lactation supply? Basically, people are concerned that when they join a fitness program, the lactation will start, getting affected. So your thoughts on the same?
Yeah, so we are basically designing this chart to support your lactation. There is nothing that, we are going to deprive you of food. No way. We're going to give you a very, very nice chart with lots of food to eat in the correct quantity to support that particular phase that you're in. Some people are coming in within a month of delivery. Some have finished 6 months exclusive breastfeeding. So we get moms in all different stages. So according to whichever stage you are in and you're joining the program, we will design it accordingly and make it specific for your needs. Many moms come in with already, PCOD or thyroid. They already may be having hyperacidity or some particular medical condition. So we look at everything and then we design the chart. And as you will know, the chart is very scientifically designed, of course, keeping in mind your weight, your dietary preference, any food allergies that you might be having, any food dislikes, or the particular cuisine that you prefer. Like, some people would like only North Indian. Some people are happy with both North, South. Some people want a Western diet. So all these things, along with, of course, the schedule of your breastfeeding. So we do have a very important question there, is like, what is the frequency of breastfeeding? So, you know, we get responses like, I feed my baby 8 to 10 times a day, or I feed my baby maybe 10 to 14 times a day. Someone must be like, I only do night feeds. So accordingly, we will plan the calories, we will plan the protein, we'll plan the good quality fats, we'll plan the foods according to that. And also, I would like to just add that the chart features a morning detox, and then, of course, your breakfast, lunch, dinner, along with your mid-morning snack and your mid-evening snacks to prevent any hunger pangs. I hope that has answered the question.
Yes, perfectly. And before we move on, you know, just coming to the food bit a little more, what are some of the foods that you would say one has to avoid for a stronger core? By this, we typically mean which will help in healing your diastasis.
Okay. So, as I would say, like, you know, having your, we do want you to have non-gassy foods. We would want you to have non-gassy foods. But sometimes, since you are vegetarian and you will be leaning more on your whole pulses, your dals, etc. for protein, we keep that in a minimum quantity. Not that you will be, you know, it will bloat you, right? So definitely having a focus on proteins, because here we're going to rebuild the muscle. All right. So we would like you to have good quality proteins, and sometimes. We also do advise that you know, have an all plant protein, because you can't get all the protein from the foods that you're having all the time. So when you have an all plant protein, it will give you that particular you know, amino acid profile that your body is requiring. So based on that protein, of course, having good amount of your folate. All right, folate-rich foods. You can go for, of course, your spinach, chickpeas, which is your chole, avocado. Avocado, again, I think is just a brilliant, brilliant fruit, because it's an all-rounder in all nutrients. And you can go for broccoli or rajma. And of course, you know, again, we talk about the muscle, the healing of the muscle. So calcium-rich foods again. So you know, you can lean on your almonds. Chia seeds, sesame seeds, your if you're vegan like me, almond milk. I mean, not much, but you know, we do get a little bit of calcium. And then your lentils, amaranth, quinoa, of course, your black-eyed peas, your lobia. I mean, black-eyed peas is just English way of saying lobia. And then, of course, your fig paste again. So these are again calcium-rich foods. And then I would say also go for your good quality fats, your flax seeds. So we do ensure that we give you a teaspoon to a tablespoon of flax seeds in your buttermilk. Many of you will have received that in your diet chart. Walnuts. So we're very, very you know, keen that you have at least 2 to 3 walnuts in the day. That's a good quality omega-3 coming into your system. Chia seeds, all right. And if you do eat fish, yes, do have some fatty fish like your salmon, sardines, mackerel, or trout. And yeah, so these are the key nutrients that we would recommend for healing, again, for, as you have asked, Ankita, for your Diastasis Recti.
All right, so now, how does it all work together? So we've talked about nutrition, we've talked about lifestyle, we've talked about the impact of diastasis, why it happens, what happens. So how do we heal this? You have to understand that it cannot be, you know, healed in isolation. We cannot recover from diastasis in isolation. It has to be a combination of your posture, of your lifestyle, how you're carrying yourself through the day. How are you lying down on a bed? How are you lifting your baby? How are you carrying things? How are you sitting and working? How are you holding the phone? So posture, lifestyle, your nutrition, and of course, how are you healing that core with the right exercises? So a combination of all of this is what will help you recover from diastasis. Now, before I get into a lot more detail about our plan, I just want to quickly show you certain movements. This would take you just about 15 minutes on any day to do, which can help you with your diastasis. This is something that will help you with your core rehab. So what you want to do is, I'm going to sit down on this mat. You can sit on a chair if you're, say, just 6 weeks postpartum, 8 weeks postpartum, even 2 months, 3 months is okay. So first of all, what I want to teach you is how to sit. Typically, people will sit on their tailbone like this. So when you go into a chair, you will sit on the tailbone. What you want to do is you want to understand there are 2 sit bones in your butt. Alright, so you want to sit on those bones down. So if you want to stand up, separate your butt cheeks and sit down on the mat. That will help you come into a tall posture. Now, if you see my posture, my shoulder is in line with my hip bone and my head is in line with my shoulder. It's not protruding forward. Alright, so the first things first you have to understand is how to sit right. So we take you from how to sit right, how to breathe right, how to hold your posture, then into our workout. Of course, all of this in detail in our class. Now, from we've been talking a lot about breathing, right? So, how do we do our connection breath? So, for the connection breath, you have to understand it is a combination of your diaphragm, abdomen, and your pelvic floor. Alright, so that's my diaphragm. If I cough, I feel a certain pressure here. That is the intersection of my diaphragm. And from here start my transverse abdomen. My entire abdomen, which inserts into the pelvic. The pelvic floor comprises of your urethra, your vagina, and anal cavity. So now what you want to do is on a nice inhalation, you want to just observe what is happening. On my inhalation, what is happening? Is my abdomen expanding or is it coming in? On the exhalation, what is happening? Is the belly filling with air or is it not? Alright, so over here, what you want to focus on is, with the inhalation, you should breathe into the sides of your diaphragm. So if you see my hand, it is moving to the side which is on my diaphragm because it's filling with air. Your belly will nicely expand because the air is going into the belly. And your pelvic floor will relax. What does relaxation of the pelvic floor mean? It means that you have to imagine that you are nicely sitting on a pot urinating. So with the inhalation, you will expand the diaphragm, expand the abdomen, relax your pelvic floor as if you're urinating. On the exhalation, you will breathe out through a pursed lip. You will squeeze the pelvic floor, which means you will purposely try to stop the flow of urine. What that will do is it will help your abdomen come up and in automatically and your diaphragm will close. So that is your connection there. On the inhalation, expand the diaphragm, abdomen, relax your pelvic floor. Exhale, please stop the flow of urine, see the abdomen going up and in and the diaphragm close. This is a very short connection breath video that I'm already doing for the first time. In our first class, we spent about 20-25 minutes just practicing this. We break it into diaphragm, abdomen, pelvic floor, then combine it all together. But if say you need help and you want to start working out post-delivery, this is the one thing that you should do. Do about 10 breaths of this for 2 rounds, maybe twice a day, and that should be good. Now, once you've taken this breath work, understood it, you want to take it to your movement. Now, how do we lie down? We don't ever lie down like this. You don't jackknife up and down because this upsets your intra-abdominal pressure. You will lie down with your elbow, take support with the other hand, and then roll over. Once you've rolled over, you will make sure that your body is in a nice neutral posture. Your feet in line with your knee in line with your hip bone, your back slightly arched, so that's normally how we lie down, and your entire upper body together. Now I'm going to just do my connection breath here again. So I'm going to inhale, expand the diaphragm, relax my abdomen, pelvic floor as if I'm urinating. On the exhalation, you stop the flow of urine and you feel this entire unit squeezing. Now you want to hold that while you hold it, breathe through your chest and nose for 3, 2, 1, and inhale, expand. Exhale, squeeze, hold it, 3, 2, 1, and inhale, expand. So again, we can do this about 10 times for 2 rounds. Next, what we can do is something called the bent knee fall down. So in the same position, you're going to inhale, expand the diaphragm, abdomen, relax your pelvic floor. You will then squeeze the pelvic floor, wrap up the core, and you will use this part of your muscle. You can place your finger right next to your bone. That's your internal oblique and your transverse abdominis. So on the exhalation, you will feel it pop against your finger. You will use that muscle to drop your knee out. So when I'm dropping my knee out, I'm not dropping it unintentionally. I'm using this part of my muscle to drop it to the side and start releasing the connection, bring it back. On the exhalation, you squeeze again, drop the other knee to the side, not all the way till you feel the pop of the muscle, and inhale, come back. So again, about 10, 5 on each side, do that. In the last movement, once you're more comfortable, you feel your core strength is better, you can do the glute bridges. You lie in the same exact posture, hands by your side. You will inhale here, expand the diaphragm, relax your pelvic floor. On the exhalation, you stop the flow of urine, your abdomen will squeeze, and you will lift yourself up in a nice straight incline. So your abdomen should not go higher than the rest of your body. Make sure the knee, hip bone, chest is in one line. And you'll inhale, slowly release, wrap one vertebrae at a time down. Exhale, squeeze, lift one vertebrae at a time, go up to a nice bridge. I'm contracting my abdomen here, using the strength that I've put here to go up. And I'm going to slowly inhale, release one vertebrae at a time down to the mat. 10 times again for 2 rounds. And once you're done, roll over to your side and come up. There are a lot more exercises that we can go into, but these are some things that you can try. There's of course mobility like cat and camel, your thread the needle, things like that that can help you. But we'll get into that once you've joined our classes in much more detail. All right, so now how do we heal diastasis recti? I told you the combination that we need to have. Now, you need to do consistent exercises like the ones I just showed you. Avoid anything that bears down on your pelvic floor. Avoid straining, heavy lifting, and definitely engage with a postpartum fitness expert who can help you do the right things. What is our vision at MamaBe.Fit? Our vision is to empower moms not just to look their best, but to feel their best. That honestly is the mission. To be the fittest version of yourself, to be strong for your baby and family is our vision. Now, what is the Diastasis Recti program at MamaBe.Fit? A Diastasis Recti program at MamaBe.Fit has 2 pillars which are very strong. One is nutrition, one is the classes that we do with you. Now, what we do with our Diastasis program is you will enroll with us. You will join a WhatsApp group where there will be other fellow moms. There will be a coach who will be assigned to that class, and we will slowly start taking you through posture, breathing, and thereafter exercises. All of this is happening on Zoom live classes because it is very important for the coach to see what are you doing. We can give you a list of exercises, but if you're not doing it properly, you can just worsen your DR. So that's how the fitness part works. Along with this, as you sign up, there's a detailed questionnaire you have to fill on your nutrition. Based on this, a nutritionist will fill in will understand your pattern, calculate the calories that you need, and give you a diet chart. We will then be on WhatsApp with you for the diet. You have to post a meal picture so that we can guide you. And every alternate day, we will meet for classes. The days that we don't have classes, we will tell you what to do, which is typically a repetition of the module that we have done when we meet. So it's a customized fitness journey because we understand what your particular problems are and make changes that we need in the classes for you. It is designed completely for postpartum recovery and not just diastasis. So core rehab, DR, generally how you feel. And of course, all of this combined with nutrition helps you achieve your fitness milestones. Now, some testimonials in front of us, because as much as I may speak, I think just for you to see what we've achieved is the best. The picture on the left is of a person who has lost 7 kgs. Her gap reduced from 4 fingers to 1.5 in 2 months. And the main benefit that she had was how a lower back pain reduced, her diastasis reduced, how her posture became better. Picture on the right, 2 months difference again, gap reduction of 2 fingers, and gap is not the only thing we measure, even depth. So sometimes the entire hand will go in, though the gap will be just 2 fingers. So even the width and depth together is something that we heal. Weight reduced was 9 kgs, and of course the improvement was fat loss, reduction of the DR, and digestion was highly improved. Picture again, one of my favorite transformations here on the left, gap reduction of 4 fingers. She came to us with a 6-finger gap and it went down to 2 fingers. A lot of people tell us, can a gap of 6 fingers, 8 fingers be reduced? Yes, it can be. This is in front of you. She lost 3 kgs in the first month, of course, had a massive reduction with the DR, the stomach appearance looked better, the bloating was better. The client that you see on the right was just with us for weight loss and core rehab post-delivery, the transformation is in front of you of 10 kgs. This is someone who is before and after. She had umbilical hernia. So a lot of people say, will this help with umbilical hernia? Umbilical hernia is when the navel is popping out. While we cannot cure it, the umbilicus can definitely go in and your core can become stronger. So umbilicus which was popping out went in and of course gave a minimum discomfort. So if the umbilical hernia is not really giving you discomfort, you don't have to worry about it. So why does this model work for you? This model works for you because it's a comprehensive diastasis healing approach. It's not done in isolation. It combines nutrition. It has a WhatsApp community which keeps you accountable. Accountability also happens in the live classes that we meet together. So all of these 5 points in conjunction with each other works very well for the moms that you just saw pictures of and many more that we have worked. Now, how many have we worked with? These are some statistics. We've trained over 1,500 people in the 2.5 years that we've been online. We've trained people online with our Zoom classes. People have lost weight. There are moms who lost consistent fat which doesn't come back. It's not massive fat loss of 50% a month. But whatever they've lost, they have kept. There are clients who were with me 2 years back and now they come back and say we maintain because we've now learned how to eat. So we will teach you how to eat. Not for a month, not for 2 months, but for your life. Fitness and how you feel and look is a lifetime effort and not just a 1 or 2 months effort. People were concerned about how their lactation had affected actually felt a boost of energy after they came on our diet. Because like Paru said, we could do healthy foods, we could do a lot of food. That keeps you energetic, supply is better, and you feel good. Till now, we've had 98% participants who have achieved complete postpartum rehab. So if you're ready to join with us, please sign up with us. We have some great offers for you. Which will come to it. Give yourself time, commit to the process, and have it. Now, what are the programs? Typically, anything that you start in life, whether you start a dance class, you start a singing class, will you join it for a month? Give yourself time. It takes a month for the body to even start understanding what the new thing is. So I suggest anything that you do, whether it's my program, anybody else's program, join for at least 3 to 6 months and see the difference because you need that time for your body. If you join us today and you use this code BFitMom, which is valid for the next 2 hours, you get a 2,000 rupees off for a 3-month plan. In this, you will get 3 months of live classes with us, 24 hours support from us. You will have 3 diet charts, which will be given through the duration of the plan. Sometimes we even make the diet different. Say if it's not suiting you, we may take your check in 2 weeks and change the diet chart thereafter. So you get a plan which is essentially for 13,499, only for 11,499, and this is for diet. This is for a chat, call with the dietitian, a call with me, live classes, and continuous support. All right. If 3 months is something that you feel is too much to invest in, of course, the offer of 2 months stands, which is for 8,899. Now, why 3 months is something that I spoke about. It is first month is just the initial phase where we are just intervening. Your muscle recovery only starts towards the end of the first month. If you just leave it at that, then you're nowhere. You're just in the middle of healing and not healing. 3 months helps us assess you better. First month, second month, third month. We know what's going on. We know as coaches what are the changes that we need to make for you. As a dietitian, she knows what the changes that she needs to make for you. If you stick to any plan for 2 to 3 months, it helps in building long-term habits. Now, what are the equipments that you need? These are very simple, inexpensive equipments. These are Amazon links that we'll send you and you can order it for the classes. And of course, coming back to the plan again, if you missed the code, we're back on this slide again. Use the code BFitMom to get a 2,000 rupees off and you will get the plan of 3 months only at 11,499 for 3 months. Now, what are the benefits of the program? I'm coming back to it again. Live classes, so personal monitoring, personalized diet, and access to the gynecologist who you heard from. And of course, at times there are moms who have certain issues that they're dealing with, mentally, and we have a psychologist also that you can speak with. And of course, 24/7 support from all of us here. Now, why Zoom classes work? Firstly, a group coming of moms helps a lot. 2, when the coach is with you, guiding you through every step of the way. It makes it more fun. It makes it more dynamic. So that's why Zoom classes work. I honestly, as a coach, no longer like DIY classes because I don't know what you're doing. How you're doing each movement is something that I need to see. So Zoom classes work brilliantly. It's honestly as good as working together in a room. Personalized diet, like I said, there will be a detailed questionnaire that you'll fill, based on which the dietitian will calculate your resting metabolic rate, understand your feeding needs, and give you a diet accordingly. So whether you're vegan, whether you're vegetarian, non-vegetarian, have thyroid, diabetes, any food allergies, celiac, things like that, all of that is taken into consideration, and then your diet is planned. Support, we are here to help you. We are not just doing this as a transaction, we are doing this, and I started this with a simple aim of helping as many moms as possible to navigate the fitness journey postpartum with ease. Gynecologist access is important because many times there are issues that you'll be facing. There are people who suddenly have bleeding which is heavy, vaginal discharge, but they don't understand it. This is apart from our classes. This is not because of the classes, so don't use it. If you have teething issues, you feel that you don't have time to go and meet your own gynecologist, we are here again. She can speak to you online and help you. So again, back to that code. I see about 350 people who joined us. I hope all of you sign up. Use this code BFitMom and get that 2,000 off. Sign us up. Sign with us for 3 months. How it will work is first level of diastasis, then we take you to level 2, level 3. By 3 months, typically the gap is closed, the core is strong, and thereafter we will then, go to rebuild postpartum, which is the strengthening exercises. So we're going to be putting this link down. You can use this code and sign up for our classes on our website. If you have any questions, this is the number that you have to reach us out on. We will help you out with regards to diastasis, with regards to our classes, with regards to the coupon code. Reach us out on this number. So the link to sign up is in your comment box. The code to use for the discount is also in your comments box. That's all from us. Thank you so much, everybody who joined us today. Ravna, thank you so much for taking time out. I can see you in your surgical attire. You took time out for this. I'm so grateful to you. Thank you so much. Thank you, Parul, for taking time out. If you have any last words for the audience, please go ahead.
Bhavna, Dr. Bhavna, you would like to go first?
Yeah, sure. I think this is an excellent initiative by Ankita, and I myself have been guided by her in my postpartum fitness journey. I remember asking her questions. So regardless of what qualification I have, my degrees did not come of much help to me because nobody teaches you about this kind of stuff. You need specific training for it. And even though I'm a doctor myself and I know the anatomy of how everything is, I still decided to take her guidance for a few things because she's the expert and I didn't want to hurt myself in a very vulnerable time. So I would definitely recommend that all moms who are focused on getting fitter and getting back to being themselves after having a kid, this is one of the best programs you're going to find out there. And I am always there to help you with any gynae concerns for anything relating to either your childbirth or otherwise. And I'm hoping to connect with all of you very soon. Thank you.
Yeah, I absolutely want to echo your words, Dr. Bhavna. This program is wonderful. Really reaching out to the moms, and especially with regards to the dietary aspect, key things which have to be kept in mind. I'm here to help you all. So looking forward to having you all.
Thank you, Dr. Bhavna and Parul. You're free to go now and do your thing. And I'm going to just take some questions. So goodbye to you. Everybody else who's left their questions, I'm coming to it now. Is there a payment link? How do we do the payment? So basically, there is a link that we're putting in the comment box. Please use that, understand the plans, and you can sign up. Is the code valid for more than 2 hours? No, it's a special offer. These are very curated programs which take a lot of effort from us. But as I said, we want to help a lot of moms. So the BFitMom code is valid for the next 2 hours. Please use this code if you want to sign up. Sign up for 3 months. We will start with the low level of TR where we make you understand posture, breathing, movement. Post that, we go to level 2 and level 3. How to join the program? Please check out the website. The link is in the comment box. See the programs, understand your level. Reach out to us on the WhatsApp number that we left in this webinar, or you can reach us out on Instagram. My page is mama.be.fit, and we will help you out. All right. Now, some more questions, generic ones. I want South Indian diet food and have a 4 to 5 kilo gap. Yes, like I said, there's a sheet that you have to fill in which we understand your dietary preference. The diet is kept close to what you eat. जो आप घर पे खाते हो वही हम diet में देते हैं. Of course, with slight changes. If your finger gap is 4, 5, if your depth is lot, we can do that. But what you need to do for that is have patience. Please don't start giving up in a month. In a month, you may feel slightly different. You're not going to feel massively different. I'm not going to sit here and say in a month I'm going to heal your DR. But in 3 months, in 6 months, I will definitely help you heal your DR unless we have issues that we need intervention from a doctor. I want to sign up for 6 months. Can I please go ahead? How you'll progress in those 6 months is something to tell you, whether from diastasis to rebuild immediately or from diastasis to diastasis 2, 3, and then to rebuild postpartum. Rebuild postpartum is our weight loss program and our strength and conditioning program. We help you lose weight, build your strength, enhance your conditioning. All right. Another question I have, I've been following your Instagram for a while and finally I've decided to join your classes. It was difficult for me because my baby, I have posture issue, urine leakage and my back hurts. My tummy is soft, squishy and I have DR. Will all of this be fixed? So when our core is weak, we do have a lot of urine leakage, sometimes lower back pain, squishy stomach. But all of that can be fixed if you have patience. So the answer is yes, you can definitely get healed if you join and have patience. And you'll have to give me just 2 minutes. My baby has come to ask me something and I've been out for 2 hours, so I just need to attend. So give me 1 second.
Program.
All right. So I'm back here with my page which has the code because a lot of you have asked for the code. So BFit Mom is the code. I've also highlighted the link that you need to join to sign up for our plans. That's right there. Please, it's starred and marked. Please use that to sign up. Apart from that, I'll still take some more questions. So can I join this with urinary incontinence? Urinary incontinence is a condition where your urine leaks every time you're coughing, sneezing, laughing. This is because your pelvic floor muscles are a little weak. With these exercises, consistent work on your pelvic floor strengthening core will definitely help you reduce that leakage to a large extent, but give yourself time. Okay, what are the other questions? Do you have a plan for diastasis and weight loss? So the diastasis plan itself, because of the nutrition support, will help you lose weight. The belly fat will reduce. You will see the appearance of the belly becoming better. So definitely you will see the difference. It is going to be slow in the initial days because you're also breastfeeding, but it will definitely happen. Is it good to consume a lot of dal and rice? Anything in isolation is not good. While dal and rice on its own are good, there are certain things you need to add to it to make it full protein. So for example, rice and beans together become a full protein. Dal and palak together become a full complete meal. So this is the exact reason why you need a dietitian whom we have. She will help you understand how you need to balance your diet. All right. Then what do we have? Can diastasis recti be completely reversed through exercises? So what is diastasis? Any gap which is over 2.5 fingers is considered diastasis. No longer do we consider a 2.5 finger gap as diastasis. If you have a 2-finger gap, you effectively don't have diastasis, but yes, we can still reduce it right up to closure state. So yes, it can be closed. Does it come back? If you're not careful with how you deal with your core in your second pregnancy, if you're heavily bearing down on your uterus and pelvic floor, if you're constipated, if you're heavily eating bloated foods which cause bloating, yes, diastasis can come back again. So you need to be careful with that. Can this affect our future pregnancies? Current diastasis recti, if healed, will not pose a problem in your future pregnancies. But yes, if you don't heal it and happen to conceive again, it can make it slightly worse. Is this link still valid? Yes, this link is still valid. Please use code BFitMom for a 2,000 rupee off and you sign up immediately for 3 months. Are recordings available? Yes. We understand you are busy, mom. Sometimes it is not possible for you to join classes. Each class recording will be given to you for 7 days and you can access it for as long as you want. I just paid through UPI. When will the classes start? My team will reach out to you personally, add to the batch of your choice. So we have fixed timings, but these are not timings that you have to choose. There are 4 or 5 classes which happen every single day. The timing that suits you most will be something that you can choose. So we will offer the timings, you can choose it, and then you will be added to the WhatsApp group. Ma'am, just paid the amount and GST bill for my company. Yes, we can give that to you. It will be emailed to you. So lots of people who are saying that they've joined now, they've used the code, got the discount, and from here are looking forward. So am I. I'm looking forward to meet you and I'm happy to be a part of your journey. Is it necessary to join for 3 months? No, it is not necessary to join for 3 months. I'm never going to force you to join for 3 months. But the only reason we push for a 3-month plan is because a significant change is only seen when you commit to any program for 3 months. 2 months, 2.5 months is when you really start seeing that big difference. Even if you start a diet, even if you start a coaching class for, say, tennis, you will start seeing the difference in 2 months. It will not happen in 8 classes or 12 classes, which is why commit for 3 months, close your eyes, commit. There are testimonials that you can see on this webinar that should give you some confidence. You can go to my page for all that we do, and I'm sure you will be happy with us. All right, so with that, I'm going to close. Thank you so much. That is the code again, BFitMom, valid for 2 hours. I am looking forward to seeing you all join us for 3 months. If you have any questions, you can reach out to us on this number, 76191010022. We will answer all your queries. Thank you so much, everybody, for joining us. Look forward to seeing you and look forward to answering more of your questions on the number that I just shared. Thank you so much.